yeah, yeah, no, just give me a call. I was listening to this. Yeah. Now take it back. No, I'm just saying we was outside. We'll get a near the setup. Yeah.
Yeah. Right.
I mean, 8, 7, 9.
Yes.
I know. Somebody else. 8, 7, 9. 6, 7, 1. That's me. Let me use so I can.
Why am I saying? Okay, I'm like, wow. Okay. Okay. Officially.
I'm my biggest fan here. Oh.
Okay, let's get started. We have people on the line. I just want to welcome everyone to your new hospital. University of Maryland Capital Region Health. As you can see, we have appropriate conference space that is available to the community, right? And so this is a great space for us to have meetings and come together and gather and share information and hopefully do further collaboration. We're looking forward to this meeting tonight. The first time, I think, in a long time that we've actually been physically together, which is also nice because while it's nice seeing faces in Zoom rooms and team meeting rooms and wherever else, it's especially nice to hug people, to give people an elbow pound. You know, so it really is. So it's good to see everyone here. So once again, thank you so much for joining us. And this is a bit of a hybrid meeting, so we have folks on the line. So when you do speak, try to speak up loudly so that people can hear you. We don't have mics at tables, but hopefully our acoustics will be able to pick you up, but not if you have a soft voice. So if you know your voice is a little softer, make sure that you make an effort to speak up just a little bit more. I want to recognize and thank all of the first-time attendees. Who's here for the first time? Oh, okay. Do you mind just saying who you are and what organization you're from?
Maria Gomez from Mary Center, and we have a site in Delphi.
Wonderful. Thank you for coming. This gentleman here.
Good evening. Greg Taylor from the Vibrant Health and Wellness Foundation.
Vibrant Health and Wellness
Foundation.
Welcome. We had, yeah.
Good evening. I'm Trina Scott with Gilead Sciences. I'm the community liaison.
Wonderful. Thank you for being here. And I think I'm missing. Yes, ma'am, please.
Good evening, Nancy Amici with Prince George's County Health Connect.
Wonderful. Thank you so much. Did I miss anyone? Oh, Pamela. Oh, is on the line. So Pamela, can you share with us where you're from?
Hi, I'm Pam Hamlin. I'm with the Prince George's County Memorial Library System for Nick Brown, who is our COO of Communications and Outreach.
Oh, that is awesome. Thank you so much. It's good to have new family in the room, and looking forward to opportunities to collaborate and partner throughout the year. I just want to do some logistical stuff for the folks who are here. Right outside of this room, we have bathrooms for male and female bathrooms or neutral gender, non-binary bathrooms. Choose which one you'd like to go in. And then we also have water filters. So if you brought your own water bottle, you can refresh your water outside at the fountains, okay? Lastly, I want you to be sure that you keep your masks on while you're here. I know everyone in this room has been fully vaccinated, but just for your own protection. If you're not eating, keep your mask on. If you're not talking, keep your mask on. And lastly, I have some good news to share that we are now officially, the Prince George's County, parts of Prince George's County is officially now behavioral health, say it, HIPSA. Health service designated areas. So we're excited about that because I guess it's official now. Okay, perfect. So what I'd like to do now is introduce our panelists. Dr. Carter, you coming up or yeah, come on up, Dr. Carter. I think you need to come up here. You have me on the hot seat.
Well, I'm just to welcome everybody and glad to see all of the members that we have here. I mean, to come out, it is good to see everybody. And we want to be sure that we, make sure that everybody understands our new direction. I have a new co-chair. We're working synergistically together, and we're very happy that we can get back together. It's just a good feeling. I'm going to just give you a brief update about the COVID-19. Is that where you want me to be right now? COVID-19, as you all will know, is the new variant is very, very contagious. And it turns out that we are still in a very high range of new cases that we get. We're getting somewhere around 90 to 100 cases a day of new people who are coming down with COVID. So the transition is extremely high. And what we want to be sure of is that we get the message out. You can go to the next slide. That everybody gets vaccinated. The reason for that is that if you can see from this graph that COVID likes to rise and fall. It's rising and falling because of the fact that, number one, it's seasonal. It likes to come. It comes in waves. It has a certain humidity that it likes, and then the people who are not vaccinated, once it finds its way into unvaccinated people, it spreads like crazy. So we've got to curb the tide of this, and as you can see, we're going back. We're just coming down from another small peak, but if you just stay tuned. In the October, November timeframe is going to go very high again. Go to the next slide. So we have to keep a very close eye on our hospitalization and our hospital capacity. And it turns out that the good news, and we're looking every day, the hospitalization from COVID has sort of stayed steady. But the problem is that that's not true for what's going on with the children, because the children are getting infected from RSV as well as COVID, and their hospitalization rates are going up very high. So that makes sense because the children are unvaccinated and they're going back to school, and this virus spreads like the chicken pox as opposed to the way it used to spread. So it's going to spread quickly among our children, and we've got to keep an eye on that. As well as I said, in the October-November timeframe, we're going to see hospitalizations even start to go up here. So we're prepared for that, and and if we can just get more people vaccinated, we can curb that. You can go to the next slide. So here are the key metrics. I mean, and I know you all probably see this on our website, that we keep an eye on. Where we want everything is to be in the green. You'll see the hospital capacity is in the green. Our other metrics are still hovering in the high to medium zone. And you can just bet it's just going to stay there until it starts to rise again. So we've got work to do. We got a hiatus, so we need to do the work that we need to do in terms of getting people convinced to get away from the myths and go ahead and get vaccinated now. Go to the next slide. So just talk a little bit about the vaccinations. We've been doing pretty well. I mean, let's face it, we've done pretty well, especially with our seniors. You can see on here that we've got at least on our seniors, we're up in the high range of vaccination. And even our 12-year-old and plus, from 12 and older, we've gotten up very high, almost into the 70% range in terms of our 12 and plus year olds. And I didn't even think that we would be able to push it the envelope as fast as we have, because of the myths and everything else out there. But parents are starting to bring their 12 years old in, and it takes the pediatricians and the providers, as well as our clergy and everybody else, to start convincing folks, get your children in there. If they can get vaccinated, get them vaccinated. Our hesitancy is hovering in the range of the 20-year-olds and the 30-year-olds. So we need help with that. You all need to give me some advice, because I don't know what to do. Go to the next slide, please. Our residents are, you can see from this slide, you can see according to age where, as I was saying, where the vaccinations according to ages are. And you can see what's happening in terms of our 20 and 30-year-olds. It should be much higher, but we haven't been able to get them there. Believe it or not, because even though the 85-year-olds are like at 10,000, that's a whole lot of them. That's like 82% of them. And you can see from the 75 to 84-year-olds, it's like 91% of them. But the 20-year-olds, it's only at 60%. And the 30 to 39-year-olds are only at 67%. So we got to do better there. Go to the next slide. Then if you look at it by race and ethnicity, you'll see that we've made some real strides in the Latino community, and they have really gone up. I mean, they have really stepped into the plate and gotten vaccinated. Now, in the African American Okay, so that's a snapshot of COVID. I hope you all heard the last part. For the most part, is that we've got a lot of work to do in terms of getting this last hump of folks vaccinated. If we could get up into the low 90s in terms of our vaccination rate, that's going to help our county tremendously. So thank you very much, and now I'll hand it back over to you.
Yes.
Okay.
We have a wonderful panel for you, clinical community partnership panel. And our panelists from my right is Norberto Martinez from the Langley Park Civic Association. And then we have Pastor Lincoln Burris from the Central Baptist Church of Camp Springs. And lastly, but not least, Samir Balal. And he is the manager of clinical programs at Giant Pharmacy. And so for the rest of our time together, we're really going to get a chance to dive into this clinical community partnership discussion with our colleagues here as panelists. And I'll dive into just a little bit more on who these individuals are. Mr. Martinez, president of the Langley Park Civic Association. He has worked with partners to plan and promote community-centered clinics at La Union Mall and Elva Plaza and the Langley Park Community Center. Pastor Lincoln Burris is the head pastor of the Central Baptist Church of Camp Springs and has hosted multiple community conversations on vaccination events at his church. And Samir Balal, the manager of the clinical programs of Giant Pharmacy, has helped stand up hundreds of temporary and pop-up vaccination sites across the DMV. I feel your pain. And then, so I just want you to use this time to ask lots of questions, put them in the chat box if you are online so that we don't miss your concern or question or idea. We want this to be a robust discussion and we want all to be able to participate. Each speaker will have a few minutes to answer questions after their presentation. So let's get started.
Thank you very much. Again, my name is Norberto Martinez. I'm the Executive Director of the Langley Park Civic Association. And I see many familiar faces. I do Maria. Maria is also there, Maria Gomez. And thank you for such an honor to be in front of you. The Langley Park Civic Association it's fairly new. We basically I've been working in Langley Park for more than 10 years, and also many members in the community have been doing a lot of work. And so we, after consulting the community, finding about issues, concerns, and many, many things that we did, and we created a committee to see if we could create the Langley Park Civic Association. And that's pretty much what I'll be speaking about. The Langley Park Civic Association became a nonprofit after so much work and making it possible. Officially, we started our work in 2020, last year. The pandemic hits us, and then we obviously had to wait a little until we actually started developing programs. So let's go to the next slide. At the beginning, we created Langley Park Athletic Council, which was basically doing work with the parents in Langley Park. We also created Padres Unidos. And then when Rashern Baker, you became our county executive, we started working with some issues related to the Transforming Neighborhoods Initiative. I'm not sure if you remember TNI, for instance. I was part of the TNIs, and then after the TNIs ended, then the meetings that were taking place with the leadership of the county executive, those meetings were handed down to many of the nonprofits and leaders in the communities, in different communities. One of those communities was the Langley Park area. And so there were so many issues that we had been working on, and then that we wanted to continue on, but because of the pandemic, we had to put a stop to some of the stuff. Let's go to the next slide. We began our research, our work, created a board, found an attorney who helped us, and then at the end, we created a bylaws. That's pretty much, I can sum it up that quickly. It wasn't that quickly, it wasn't that easy. It was just a lot of work and questions, and you probably know some of that, how much it takes to create something. Let's go to the next slide. Again, the pandemic hits us. We start right away developing, asking our communities, what are your needs? What exactly do you need? What's going on? How do you feel? Many people are really, really affected by the pandemic in Langley Park. We had very high numbers, and we were very concerned that the community was getting hit hard. Then we started creating rental assistance program. We created GoFundMe to get funds, Facebook and Instagram. We began working with the county executive and also with the council member Danny Taveras to create the food deliveries. If you remember at the beginning, the first thing that came into many of the neighborhoods was food, basically, food boxes. And we were right away involved with that. And then gift cards. We created also Thanksgiving food assistance, toys for Christmas, all kinds of stuff started to develop. This is all on obviously in sort of an emergency mode. So let's go to the next slide. And COVID testing was one of the things that we also were working on. We right away got connected with many of the leaders. Some of you were, I think, in some of our meetings at the beginning when COVID testing was taking place. And then vaccines began being the main focus later on. And then we got involved immediately. We were asking everywhere, who's doing vaccines, where, how, who's leading it, what is there, right? So we were finding that too many people were doing vaccines at the very beginning, and we were not finding the actual contacts that we wanted to really connect with. Until obviously we found some of you, like Allison, for instance. We thought, okay, Allison is going to lead us and work with us. And since then, we haven't let go of Allison. We have been there pleading for Allison to continue to help us bring vaccines to the neighborhood. And we did. We have been doing lots of vaccines. I don't know. Okay. I'm not sure you already have captured that. But let's go to the next slide. The mission, Langley Park Civic Association is to promote, advocate for a better quality of life of Langley Park resident, community, and residents in neighboring jurisdictions. Pretty much that's what it is. That's what we came up with, and you can see there on our vision, our purpose, all this. I'm not gonna read it, but let's go on to the next slide. I think we're 501c3, officially, like I said, our board continues to work with us. And there, I put some names there of the members of the board for the Langley Park Civic Association. Let's go to the next slide. And our role, basically, we have been working, like I said, I've been one of the persons lucky enough to be at the forefront and underground. You actually organize the setup, the takedown, the promoting, the speaking with, due to our bilingual skills, we're able to communicate immediately with many of the neighbors in Langley Park. More than 60% of the population is Spanish speaking. So once we hit the ground in Langley Park, we're in our basically home. And so that's how we basically were able to do it. The language is very important. And I think that is something that we have been able to use intelligently. Post-pandemic, our role, well, I hope that once, I don't know exactly how, I can't envision what's gonna happen, but I'm hoping that as soon as this pandemic, it's not gonna end, I think, but as soon as things slow down, then we're able to really sit down and start reevaluating not only the work that we've done so far, but to also put forward programs for the Langley Park community that will benefit the immediate residents in Langley Park. We're the only nonprofit that has been founded so far in Langley Park, and that we're the ones that are basically, we work in Langley Park, we do work in Langley Park, we know many of our neighbors, we know many of the residents, and so we are right there. We're lucky enough to found a fertile ground to really come out of into the open air. So thank you very much. If you have questions, I'll be happy to take them either now or once the other speakers end. Thank you very much.
Yes, thank you for your presentation. I was wondering, now, where are you all located in Langley Park? I'm familiar with Pasadena, Maryland, so I'm now learning about you all, and it's good to know the great work that you're doing in the community. Physically, what is the site where you all are located?
Right, well, physically, we do not have an office. We're floating, so to speak. We're new, we don't have a budget for it. We frankly don't have a budget for many things. We miraculously have been doing a lot of work in Langley Park. We float between the Langley Park Community Center. I've been doing a lot of work with the community center from, from organizing Langley Park Day. I'm not sure you heard of that event. Health fairs, cleanup, green up events that we used to do. We continue to do them every year, every spring and every fall. And so we're basically just around everywhere. We don't have an official office. We use a PO box for now. But as soon as we find a space, we'll be back in our neighborhood.
And the population, one last question. The population, so you're serving, you said all of Langley Park, so your focus is more so.
Right, the population is the way I have been able to experience it and see it on the statistics is more than 60% or a little over, I think 64% are Latinos. There are mostly three populations that are the biggest in Langley Park. One is the Guatemalan community. And as Allison may recall from some of our meetings, many of the Guatemalans are actually Mayan, and they speak different Mayan languages. And then the other community is the Salvadoran community, that is also large. I would think the largest is Guatemalan, Salvadorans. There's some Mexicans, some Hondurans. I don't know of really any South American. That's possible, but I haven't seen any. I've seen mostly Central Americans, mostly Guatemalans and Salvadorans, some Mexicans and Hondurans. And so the populations are very different from one to another. It's completely different populations. You see, well, Guatemalan is not the same as speaking to a Salvadoran or a Mexican. So yeah, it's very diverse. It's very, very diverse in terms of community population. So I'm used to it because I've been working with many of the communities in many Central American communities in around. I mean, I lived in San Francisco for many years, and many communities were also Central American in San Francisco itself. And I was lucky enough to work at the Central American Resource Center, and I did a lot of work, legal work, with those communities, and I got to know them closely. Their history, their language, the use of the language itself, their culture, a lot of stuff. So I was lucky enough, and so when I came here, I was able to familiarize myself even further with them. Other questions?
Thank you so much.
Sure, you are welcome.
Thank you.
Okay. All right. No, go ahead, sir.
I was just thinking out of the box, since you have established a momentum over in Lanham, not Lanham, but Langley Park area, where there's a heavy concentration, as you alluded to, in that area, but there's pockets of Hispanics and other Asian folks in various pockets, such
Correct.
right here in Keppel Heights per se. And
Yeah.
I remember about a year ago or so, I developed flyers in Hispanics to pass out about a conference, but the fact that the trust was not there.
Correct.
No one shows up. So I'm just wondering, have you thought about establishing tiger teams and going into other parts of the community to increase the awareness of the vaccine?
I would put my dream there. I think we should expand eventually. At the moment, we don't have the resources and it's a capacity as well. Otherwise, we're not able to really expand that. But you're right. If you go to Riverdale, the majority are Mexican. Bladensburg rather, Lanham, you see lots of Mexicans. And then you go into areas like Oxon Hill, you see some Dominicans, and then you see some Central Americans, Guatemalans and some Salvadorans, for instance. Yeah, I'm very familiar. I've been working in the county for a while. Let me just tell you my other hat. I work at the circuit court for Prince George's County. And through the circuit court, I've been able to do a lot of outreach throughout the entire county and have been able to meet a lot of people in basically the entire county. And I've been able to see where people live, Dominicans, Puerto Ricans, and mostly in many Central Americans. I have been able to connect with them. So it is true. Hopefully we expand in the future. That would be a great thing to do. Yes. Other questions? We have 30 seconds left. Just kidding.
I just want to thank you. We were lucky to find you and the Civic Association and all the partners you bring. It's been wonderful working with you.
Well, thank you, Alison. Coming from my high leader, Alison, I thank you. We have been. I'm on the fast move pace. My pace is like this sometimes, right? And so. In terms of emails, I respond immediately. I send emails, I do this, I do that. And then in terms of the groundwork, working on the setup, then you probably some of you have seen me in action. I have to tell people, okay, tent over here, tent over there. This is what we're gonna do. Boom, boom, boom. Here's the map, right? And then because we also have to have volunteers that are bilingual. I have to be able to switch quickly. And that's amazing. That's how our brains work, right? We 1 second we're speaking in English, and then the other room we're switching to Spanish. And so I've been able to really work with many of the volunteers to tell them what exactly it is that we're doing. The setup, the takedown, a stay from beginning to end. Typically, many of those, all of those events actually have stayed. So in most have been very successful. We have had very successful events in Langley Park, and I'm sure Dr. Carter had those in the numbers that we have. He showed us earlier. Thank you very much again.
Good evening. I want to thank you all for inviting me to come and share with you all on this evening. I find it as a privilege and an honor to have clergy here addressing the Prince George's County Board of Health. Thank you all so very much. And to Allison, thank you, and to my new best friend, Dr. Carter. We've been in this together. I'm Pastor Lincoln Burris Jr., pastor of the Central Baptist Church of Camp Springs. We were founded in Washington, D.C. back in 1964, moved to Maryland, the Temple Hills Camp Springs area in 2005. And our mission has been seek lost souls who Christ to edify the saved, glorify the saved. I'm not home for each. But that's our mission. That's our mission. And what we have found out is that we have lots of members all throughout the DMV. We have members that are in King George County, Virginia. Because of COVID, we now have members in Florida, Georgia, North Carolina, South Carolina, California, and Texas. I'm saying that because those states, we know how they feel about the vaccination and wearing masks. So we're trying to work with our brother and sister churches down there to take the information and resources that we have here and share with them to help in the battle of COVID to get people vaccinated. Let me give you a quick history. We all know when COVID hit very, very, very hard. And it caught a lot of churches off guard. One Sunday, you're full capacity. The next Sunday, they tell you 250. Then the next Sunday, they tell you 10. We have a membership of over 1,200 people. And so you can imagine going from 1,200 to 10 in less than 2 weeks. So we adjusted, we did that. A few weeks later, we said, okay, what can we do to serve the community? Yes, we have been doing things in the community. So we said, hey, we've always wanted to do a food distribution, so we started a food distribution. On our first food distribution, we shut down the Beltway and Branch Avenue because everybody was coming to our church to get food. And Lord knows we didn't have enough. There was some disgruntled folks, so my team said, hey, let's stop. We can't do this. I said, no, we're gonna do this. We're gonna get better at it. So we got better and better each week. We have a constant clientele that comes through every week. New folks come by, and so we have now gone from serving about 50 in the beginning, now to over 500 every week. And so we started out by serving food. And so as time went on, we looked, what else can we do? What else can we possibly do? We were already, prior to the pandemic, doing things somewhat in the health arena. We had a personal trainer that did wellness classes for our seniors and those in the community. We still have a cancer awareness ministry that brings attention to all types of cancer. As a matter of fact, Sammy's Blood, we're having one of those virtual seminars in 2 weeks as we're going to address childhood cancer. And then we're also on plan to do in the first week of October virtual breast cancer awareness walk. So we thought we were doing well. But COVID showed us something totally new that we never even imagined that we can do as a church. So we're still sitting there, we're serving our food, we're trying to connect with our congregation and the community. I get a phone call from Governor Larry Hogan. I get a phone call from Lieutenant Governor Rutherford. I get a phone call from Councilwoman Monique Anderson Walker, and they say, can you help us? I said, what is it that you want us to do? Can you serve as a vaccination site? And if you'd have told me when I first started as pastor 9 years ago, that we would open our church up to put needles in arms, I probably would have said, not going to happen. But then when I looked at our mission said, if we're to seek lost souls, okay, if the lost souls are sick, what can we do? Jesus, I'm sorry, this is Pastor. Jesus, he met the needs of the people. They were hungry. We were feeding. We were giving them the word. But guess what? We were not healing the people. We were healing their souls, but not the body. So I said, here's a great opportunity to do this. So we started off and we put a link out there, and folks had to call in and not call and go in. They clicked on it. They do that. We work with the 100 Black women of Prince George's County. They did the follow-up phone calls to make appointments. We were partnering with Walgreens, and so people get mad because we didn't have enough appointments. So we worked with Walgreens for about 4 days, and so in those 4 days we vaccinated about 2,000 people. So we were excited. Okay, my staff, folks, members of the church that came, they volunteered. They were excited that they were able to invite folks in the church and put needles in their arms and share with them. And so through that, my team, anytime when I say vaccination, I have so many folks in my church showing up to open up our doors, to greet the public, to say, come on in. And so here we are. We partnered with, not Walgreens, I'm sorry, Safeway. Our next partner was Walgreens. So we partnered with Walgreens in April. We were with, in May. We partnered with Safeway in March. So after we did that, we thought we were finished. We said, job well done. We've done close to 3,000 people. Okay, let's retire. And then I got an email. I don't know how I got on this email. Okay, and I met Allison. And Allison says, well, anytime you have an event, we'll be glad to show up. Don't tell me that, because every event that we have, I'm calling. You know, I called and asked for Dr. Carter. I mean, that's what Dr. Carter, he is God sent. He's been there to not just address people in the community, but we did last week, we did a video recording that we're going to show all throughout the country. And he represented us as Prince George as well, so let's give him a hand. We're going to share all throughout the country about COVID vaccination, why it's important. And so we did all these things, and we're still doing it. As a matter of fact, Giant, okay, they're going to be back giving out second vaccinations in our church on this coming Saturday. But not only that, they're also doing flu shots. And so what we have decided to do at our church is to expand our horizon, that we're going to be more health friendly, bring folks in to help us out, partner with the medical professionals to do these great things. And before I take my seat, before I answer any questions, also the pandemic has pushed us to also care about people's mental health as well. We have been blessed to have a mental health expert on our staff that we now have what is called Mental Health Mondays, and our church members can call in and they can just vent. We talk about subjects. We talked about suicide last night. We talked about any and everything. And so we've now changed the whole focus of our church to be more health and mental health friendly. And so that's our story. Any questions? I'll take this. Thanks so very much.
I don't think I'll speak as well as you. It's a hard act to follow. Good evening, everybody. My name is Samir Bohal. I am a pharmacist by trade. I've been with Giant Pharmacy for now 19 years. Not always as a pharmacist, start from the bottom, but now I'm the clinical programs manager for Giant Pharmacy. So many of you guys may know or may not know what pharmacists really do. Many of you think that we just count pills, slap it, stick it, throw it out, and make you wait 20, 30 minutes, right? So I think what the pandemic has led to is a better understanding of what pharmacists really can do and the power of pharmacy and the access that we have created throughout the pandemic. Back on December 26th, I got a call from DC Health telling me that I'm getting vaccine. Didn't know where to put it, how to handle it, how to store it, how to train my pharmacist. We do nothing, right? And I think that also is testimony to everybody in this room that we've all had to pivot fast, quick, adapt, change, learn, make our protocols, change our protocols. And I think we've all been tested this past year and a half or 2 years. So once we figure that out, by January 25th, we get a call from Governor Hogan. Governor Hogan says we want to partner up with Giant Food to offer vaccines in the state of Maryland. me looking at the heat map and just in general, I knew where I wanted to offer my services, and that was most definitely in Prince George's County and other cities or other jurisdictions that have been most negatively impacted by the pandemic. A whole other thing about equity when it comes to the vaccine, right? People that were able to stay online and register through portals or be able to stay by their computers all day were able to get to the vaccine. I like to call them champagne problems. Back then, we had not enough vaccine, but people blowing down our doors. There were people that were staying in our stores from 4 a.m. waiting for leftover doses, people walking by the pharmacy just like, asking. And it was just like, go home, please. Because literally it was putting our pharmacists in a position where they had to police the vaccine. And that's the last thing we wanted to do. It was, for us, what was important was just putting shots in arms to the people that most were negatively impacted by the pandemic. That's when my relationship came across with Allison Mendoza, as well as Dr. Carter and Caitlin Murphy and Kim Stitch-and-Combe, which I would, at this point, I think I should get a house in Prince George's County because I feel like I'm a part of this relationship. And I mean, you guys should buy me a house. No, okay. But yeah, I feel like we work so well together. I mean, at the end of the day, the thing about pharmacy is that 90% of Americans live within 5 miles of a pharmacy. And I think what the pandemic has done, it has become a catalyst for health inequities and addressing barriers and access to healthcare. So with that being said, utilizing a trained healthcare provider like a pharmacist, I went to 8 years of school. I have a doctorate in pharmacy, and just because I may work behind a counter doesn't mean that I don't have the didactic and clinical training that is required to provide services to people who need them. With that being said, because we're so accessible and with doctor's offices shutting down, it's kind of hard to get into your doctor's office or address certain issues virtually or show them that rash when a pharmacist could potentially address that issue. And more importantly about Giant Food and Giant Pharmacy is that we're a grocery store we're a pharmacy within a grocery store. And we can all agree that one thing that has been consistent throughout the pandemic is grocery stores. With restaurants being closed, with people having to work from home, buying more groceries, our grocery stores employees have been working around the clock. In addition to that, our pharmacists. If you remember way back in March, when there were shortages of medication and people were getting overrides on their medicines, pharmacists were there working round the clock, getting your 90-day supplies and an additional 90-day supply, making sure that you stay adherent to your medications. We didn't want people to be hospitalized for exacerbations of cardiac conditions, asthma conditions, simply because they couldn't get their medications or they were not adherent. So we were working around the clock to address medication therapy management issues. Going back to the pandemic and what we've done in Prince George's County more specifically is I've been able to develop relationships with the government and the health department. And ultimately, I just want to put shots in arms. That's what we want to do. That's what we do best. At this point, we've done over 500,000 vaccines in DC. So we've had a lot of success, but having the relationships with the community partners has been imperative to our success. I feel like I see Caitlin and Kim and Allison every week. You guys have my Monday mornings every morning. I don't always look like this, but Monday mornings, bright and early, we have our conversations to address what the needs are of your community. I don't know what they are. And honestly, I feel like what we've done here in Prince George's County has been the most successful. I manage Virginia, DC, Delaware, and all of Maryland. And being able to work with community partners and health department leadership where you essentially marry us with the facilities and allow us to develop those relationships where we can come on site, do what we got to do and get out. See you back in 28 days, see you back in 21 days, and ultimately offer the best customer service experience that our pharmacists have been trained to do. Moving forward, as we will be doing at Pastor Burris's church this Saturday, is offering other immunizations. And I think that's what COVID has done as well. I feel like we've focused so much on the COVID vaccine that we've forgotten about all the other non-flu and flu vaccines. with children going back to school and many of them not getting their back to school vaccines and getting their wellness visits. I know that in many areas, doctors are backed up for weeks and kids are going back to school and many children haven't seen their doctor in over a year. It's kind of hard to deliver an immunization virtually. So being able to activate our community pharmacies, and not just Giant, I think it's every community pharmacy is critical to just the overall public health of our country. I mean, just because we focus on COVID, we're not addressing measles and we're not addressing varicella. And these are all things that these conversations have to be continued to be had. So heading into flu season, here we are, and I'm so glad that you do appreciate and understand the importance of the flu shot, and hopefully your congregation members do recognize it as well. This has caused a change, and I'm so excited to embrace it and to provide the support that I can provide with my teams to help better educate people here, not just in Prince George's County, but as well in the district, DC metropolitan area. So. Again, thank you guys so much for your honestly collaboration, and it's been a great. It's been crazy, but it has been a great year and a half doing what we've been doing. Any questions? Yes.
So you mentioned that you, of course, and what you're doing, what all of you all are doing is awesome. So you are truly to be commended. We appreciate everything that you do. And so what I wanted to find out for the flu shots and all the other vaccinations that you will be offering in addition to COVID vaccinations, is there a fee for the church or for the different organizations to have Giant to partner to come out and serve the community, say if it was within a enterprise zone or within an area where incomes were low, or just a targeted area? Is there a fee associated with that, or how would that work?
Yeah, so generally, especially for the 65 plus community, the annual flu shot, pneumococcal, as well as overall nationwide, the COVID vaccine is no charge, right? But let me rewind, I'm sorry. The COVID vaccine is no charge if you are uninsured, and that was a lot of the communication that we had to make sure we danced around very closely, simply because we just needed a valid ID or an ID stating your correct address, because ultimately what happens is that the pharmacy is responsible for reporting this information to the state registries. So what happens is if your information doesn't get reported to the state registries correctly, when John Smith, if it's not spelled right, bounces back, or he tries to find his vaccination records, he won't be able to find it, right? So that's why the ID thing was very critical. Of course, we didn't want it to be a barrier in access to the vaccine, but we encourage that. But as far as the COVID vaccine, that is no charge. Flu shots and pneumococcal is no charge for patients 65 and up, as many of them have Medicare Part B. And then all MCOs and Medicaid patients, flu shot is no charge as well in Maryland. So the service for coming out, there is no service for coming out. We do realize that coming out to the community is really what we need to be doing, and that's proven to be so successful. But at the end of the day, there's no charge to come out.
Thank you.
Thank you.
I did have a question for you though. What are some lessons learned that you may have for the community members here as you've been in different places to facilitate the COVID vaccinations?
I think.
Or key strategies for us?
Sure. I think that's actually what the pandemic has been, and what it has taught me is that there's no way to blanket anything. So everything is a la carte. Everything is concierge. I can go to one site, I'm doing hundreds of doses there. It's not going to work for your site. Everything has been a logistical nightmare. And it's one of those things, I think that many of us are very scientific and type A and type. We're want cookie cutter. There is absolutely no cookie cutter that will fit everybody here. Of course, there's going to be those same underlying themes, but I guess the piece of advice that I would give is flexibility and understanding that we don't know either, right? And I think that's what I learned from a lot of clinics is that you want it to go this way, we're expecting this many people. All right, look, this is the basic groundwork that we need, this is how it's gonna go, and we just gotta pivot accordingly. And I think that's what it is, and that's what all of our lives have been for the past 2 years, to be honest. So.
Well said.
Thank you so much to our panelists, and you mentioned getting connected with the coalition, but often it's a chain of events that happens before you get on my distribution list and never stop hearing from me. For example, at Giant, we work closely with the nutritionist in the Healthy Eating Active Living program, and she said, "Oh, you should meet Samir, he's great." And that's how that connection was made. For Pastor Burris, it was through another coalition of pastors, who was through a county government employee. So really, it's this coalition web that brings everyone together. And what Megan and Slender and I do is manage a list. So we want to talk about how to sustain these partnerships. We don't want to just sort of disband once COVID is under control. And so we have a short exercise to brainstorm on that. And so, sorry, you'll see 3 sticky boards, and we put the same sticky boards, but we just put 3 so that to eliminate crowding. And so what we want you to do, if you're a community organization, tell us what you want our clinical partners to do, what you want to see from our clinical partners. I made up a couple examples here. So if I'm the Langley Park Civic Association, maybe I want to see more nutrition education in Spanish. So that's the type of ideas we want from you. And if you're a clinical partner, talk about what you want to do in the community, what you want to see in the community. So for example, if you're a hospital, maybe you want more people involved in those diabetes prevention programs. And maybe it means bringing the diabetes prevention programs to one of our community centers. So we want your ideas in person. You have sticky notes at your table. We have a sticky board here in the back and in the back corner. And if you're online, there is a link to a Jamboard, which is a virtual sticky note. So click on the Jamboard and we'll have about, not too long, just 7 or so minutes for your ideas. We also want to know if you know other community partners. That's how people come to us, this web of people, and then they end up on the master list and then end up here. But go ahead, open it, we want to hear your thoughts, and we will, this is a data gathering exercise, so this is not in vain, it's not pretend. We're going to use this in the coalition to continue to build these partnerships.
Let me write my email. Oh, you have my email? Oh, okay. All right, sounds good. Thank you.
Can't bring them. We have flyers at the food distribution.
Hi, Anthony.
I know, right? Just when we thought we were too busy. I mean, 2 years ago, we thought we were really busy, right? Where are we getting the bandwidth? Where is it coming?
It's terrible. One of the things that's come out has been. It's not, at least with our agency, it's much more willing to pivot and do things that you would have never. Really.
Right, yeah, you take a look and say, whoa.
There's a lot of hesitancy. When you don't.
Well, and this is why this conversation is important, because a lot of us made new friends that we didn't have before. And we don't really want to lose them. And we have to figure out other ways to maximize those relationships. My team goes out and does the stand up and deliver when they hand out the flyers for health insurance. You know, all of that. I mean, we're making connections without even trying on it. You know, we find out things from the people that are in line. Good conversation.
First time. And they pretty much. Family services had their. You're not gonna shop, right? Yeah. So they came, they kind of kept them. They came. They are that. Gene, and the copies. No, we can't break it. But give them some church.
Right, something to get off the devices for at least an hour. Break from the device.
You can't put his life in that.
We'll have one.
Offering things virtually.
Getting their weight, getting their walls, getting their activities.
Are they?
Well, even with the work group, you know, meeting in person with the work group, maybe 9 or 10, And now that we meet virtually, nobody has to fight the beltway. 29 and 30 people show up. Like, we have to come up with things.
Thanks so much for your thoughts. Let's get your last sticky notes up there. Let's get your last ideas. If you have ideas following the meeting, you know where to reach me and my team. We're the ones that send out the emails, so you can just reply to one of those meetings. We love being out in the community. It's a lot more fun than our conference room, which is a little bit dated. So if you would like to host, we are looking for hosts, always looking for ideas, speakers and panelists to cover. Thanks so much. I'll turn it over to Dr. Carter to close us out.
A little bit dated. See, this is what I have to put up with you all. But I do want to say thank you all for being here. I really appreciate, of course, our panelists, Mr. Martinez. We've got a lot to talk about, so I'll just leave it at that. You know, Pastor Burr, you know, and Amir, you all know what we got to do. And the one thing that's really good about what we're doing now is that we're forming the network that a public health department has to have in order to do anything. I can come up with all kinds of thoughts, bring in all kinds of money, it doesn't matter. Because what matters is how we reach the community. And the only way we can reach the community is by having community partners. And not just having community partners on paper when you need it. You have to have community partners when they need you. So that's where we are. I mean, the COVID-19 has shown us that we have to have community. I mean, and my concept of it has changed. I'll be honest with you. I mean, you have to understand basically how to continue a network, not only just form it, but continue it. See, that's going to take some work. That takes energy. It takes us working in not just an academic framework where you're just working with your mind. It's not just the physical work where you go out there and you do, but it's also your spiritual work. And that's the only way. One thing the panelists have all shown when they talk, you don't even have to hear them. You know that they're going to do so. You know why? Because they're in spirit. There's no question about it. You can hear, you can just hear it. Isn't that right, Pastor? I mean, it's just, I don't have to, everybody said the same thing spiritually. We got it. We're going to help people and we're going to make them better. That's all you know. That's all you needed to know. From that point on, we can do wonders. We can work miracles. And that's what we're going to do in Prince George's County. Prince George's County has the people. We have the right people here, no question. Then you say, well, do we have enough money? There's always, we can find the money. It's not where it starts with people saying we're going to get it done. Once that happens, God makes the money come, doesn't it, Pastor? It comes. We're not worried about that. So we're not worried about that. We want to be sure that we build upon what we're doing. So I want to thank you all so much for coming. I have to thank my team, Allison, Caitlin, Kim, Sylvette, and I'm probably not everybody, whole health department. It's just an amazing group of people. I mean, from whatever we're doing, they'll step into the plate. But we've lost people, we don't have everybody we need. But we have everybody we need because we're gonna make it work. So I thank my folks and I thank you guys for coming. Please stay with us, stay tuned. This is our year. This is our year for building the infrastructure for what we need to go into the future. I see Maria out there. I just have to give a plug for Maria because when I first came in 2012, I saw and we talked with the FQAC. I saw it was tension. It was a lot of tension. Isn't that true, Maria? It was tension. It was a lot of tension. We're getting rid of that. We don't need tension. We're gonna be collaborative. And that's what's gonna make us work. We're gonna be really, really collaborative. So thank you guys. I'm gonna close it out. Thank you. We're gonna get back to you. Allison will get back to you with the input from the feedback from what we just did. And we are getting ready to get back together as soon as there are announcements you wanted to make, Allison, perhaps, I don't
Next
know.
meeting, December 14th, and take food.
Yeah, that's right, please take food. Thank you, guys.
Don't get upset.